If you have prostatitis and masturbate, watch this video. Hello, and welcome to the Senior Club. Today, we're going to dive into a topic that might seem a little sensitive, but it's incredibly important for men's health, especially after the age of 50. We're talking about the connection between masturbation and inflammation, or enlargement of the prostate. The prostate is a small gland about the size of a walnut, located just below the bladder and in front of the rectum. As men age, this gland often tends to enlarge, a natural condition known as benign prostatic hyperplasia. However, this can lead to urinary issues like difficulty urinating, frequent nighttime urination, or feeling like you haven't emptied your bladder completely. So many men wonder, does masturbation have any effect on this condition? The truth is, masturbation or self-stimulation is a completely normal and healthy behavior, especially in adulthood. In your later years, it's not just a way to relieve stress, but it can also bring a sense of relaxation and joy, helping to lift your spirits. Mr. Michael, 68, who lives in Texas, shared that after his wife passed away, he often felt lonely and had trouble sleeping. But taking time to care for his own body, including masturbation, made him feel more at ease, helped him sleep better, and boosted his mood. Besides the mental benefits, masturbation also has real physical advantages for male sexual health. Regular stimulation of the genital area improves blood flow, delivering oxygen to nourish the tissues. This can help prevent erectile dysfunction, a common issue for older men. Keeping a healthy sex life helps maintain sensitivity in the related organs, which supports both emotional and physical well-being. In fact, a study in the US found that men over 50 who ejaculate regularly, about 2 to 3 times a week, have a lower risk of prostate issues compared to those who are less sexually active. Ejaculation not only helps relieve pressure that builds up in the prostate, but also reduces the risk of inflammation caused by fluids being retained for too long. Mr. John, 72, followed his doctor's advice and maintained regular ejaculation through masturbation. After a few months, his nighttime urination and urinary urgency significantly improved. Of course, the key is to engage in this activity moderately, gently, and in a way that suits your health condition. If you're experiencing severe prostatitis or persistent pain, it's best to consult a doctor before continuing such activities. In short, masturbation is nothing to be ashamed of or afraid of, as long as it's done properly. For many older gentlemen, it's actually a way to stay healthy, lift their spirits, and improve their quality of life. So go ahead and take care of yourself at any age, because your health and joy in life are always worth it. However, while masturbation can offer many health benefits for older men, especially in supporting circulation and relieving stress, it's important to remember that this is not an official treatment for prostate conditions. Masturbation should be seen as one part of a healthy lifestyle, along with other habits like eating a balanced diet, maintaining a healthy weight, and exercising regularly, especially exercises that strengthen the pelvic area, such as Kegel exercises. Mr. David, 68, after being diagnosed with mild prostate enlargement, didn't just rely on medication. He also practiced Kegel exercises daily, adjusted his diet, and occasionally masturbated to maintain comfort and keep his reproductive system functioning well. As a result, his nighttime urination and discomfort significantly improved. Have you heard of Kegel exercises that help improve sexual performance and reduce erectile dysfunction in men? If you'd like to learn more about this exercise, drop a number 1 in the comments. The more interest we see, the sooner we'll make a detailed video to guide you through it. Back to the topic. Not every man is suited to use masturbation as part of their routine. For those undergoing treatment for serious conditions, such as advanced stage prostate cancer, or those experiencing acute inflammation, self-stimulation might cause pain or discomfort. In many of these cases, doctors may recommend limiting sexual activity, including masturbation. The key is to always listen to your body, and if you're unsure about anything, talk to your doctor to get the right advice. Psychologically, many people worry that masturbation might worsen their condition. This feeling is completely normal. Sometimes, due to social stigma, some older men may feel guilty or ashamed for still having sexual desires in their later years. But the truth is, friends, as we age, our bodies go through many changes. These changes happen not only on the outside, like graying hair or wrinkles, but also inside, especially in terms of sexual function. However, that doesn't mean the desire or ability to connect with your own body disappears. On the contrary, when done correctly, masturbation can still be a healthy part of daily life, helping older men stay mentally positive and support prostate health. Mr. James, 72, from Tainan, used to be very anxious because after prostate surgery, he wasn't sure if he should continue masturbating. After having an open conversation with his doctor, he got a clear explanation and detailed guidance. Now, he feels more at ease and continues to enjoy a fulfilling emotional life without worrying too much about negative effects. To do this in the best way possible, first of all, masturbation should be done in a quiet, private, and comfortable space where you can fully relax without being disturbed. This could be your familiar bedroom, either during a restful evening or during the day when you have some alone time. Feeling safe and private will help your body relax, making it easier to achieve both mental and physical comfort. When getting started, there's no need to rush or feel tense. Some people find it comforting to recall pleasant memories from the past or imagine calming, soothing images. You may use a personal lubricant to reduce friction, especially since skin can become thinner with age. This helps make the experience smoother and prevents unwanted irritation or injury. As for frequency, health experts recommend that older men masturbate about once or twice a week, depending on each person's condition and level of comfort. One important note: don't try to force yourself if you're not in the mood. Masturbation is a form of self-care, not a task or obligation. If you feel tired, experience pain, or notice unusual symptoms afterward, such as lower abdominal pain, a burning sensation, or the presence of blood, you should stop and consult a doctor for a checkup. In summary, masturbation can be a healthy activity with many benefits for older men, including those with prostate issues, as long as you're not in a group that doctors have advised to avoid it. It's a way to keep your body functioning regularly, stay in touch with your emotions, and support both your mental and physical well-being. And most importantly, each of us has a unique body and health condition. So don't hesitate to share your concerns with your doctor or a health professional. They're the ones who can help you make the most suitable, safe, and positive choices for yourself. Or, if you still have questions, feel free to leave a comment below this video so we can give you the best answers possible. Thank you for taking the time to watch today's program. If you found this topic interesting, please hit the like button. If you haven't subscribed to the channel yet, click the subscribe button and turn on the notification bell so I can keep sharing useful knowledge about healthy aging. And if you found this video helpful, comment number 1. If you feel it wasn't quite right, feel free to comment 0 so I can improve in future episodes. See you next time, where we'll continue to explore ways to live happily, healthily, and meaningfully every day.